Hello, everyone. Lance here. Today, I wanted to talk to you about how dementia impacts the cost of senior healthcare and caregiving. Dementia significantly increases both direct healthcare costs and the broader economic burden on families and society. For direct medical and long term care costs, people with dementia incur annual healthcare costs that are 2 to 3 times higher than those without dementia. For example, in the year 2021, average annual costs for Medicare beneficiaries with dementia were about $41,757, compared to only $14,026 for those without dementia. In 2025, the total annual cost of dementia in the United States is estimated at $781 billion, with $232 billion attributed to medical and long-term care costs. Medicare and Medicaid bear a large portion of these expenses, but out of pocket costs for individuals and families are also substantial. In 2025, out of pocket spending is projected at $52 billion. How about unpaid caregiving and family burdens? A significant share of dementia care is provided by unpaid family and friends, who collectively contribute billions of hours of care annually. In 2025 alone, this unpaid care is valued at $233 billion. The lifetime cost of dementia per patient is estimated at $395,000 to over $700,000, with families shouldering about 70% of these costs through unpaid caregiving and out of pocket expenses. Family caregivers often face lost wages, reduced work hours, and emotional strain, with annual earnings losses estimated at $8 billion nationally. Out of pocket health and long term care costs for families with a senior who has dementia average more than $10,000 per year, over 4 times higher than for seniors without dementia. In the last 5 years of life, dementia related out of pocket costs can consume a third or more of a family's wealth, disproportionately impacting families of color. Let's talk about the societal and economic impact. The combined direct medical costs and the value of unpaid caregiving for dementia are projected to rise sharply, potentially reaching $1.6 trillion by the year 2050 in the United States. The economic impact goes beyond healthcare, encompassing lost productivity, reduced quality of life, and financial instability for families.